Welcome back, ladies and gentlemen, to Jaguar Health's channel committed to discovering, developing, and commercializing plant-based prescription medicines for urgent global health needs. Joining us is Lisa, the Chief Executive Officer. As always, welcome back.
Thank you. Thank you. Happy to be here as always.
And always happy to have you back. You guys have been dropping a lot of news recently. I want to dive down into here because Jaguar Health completes a final regulatory filing for conditional new animal drug approval for Canalevia to treat exercise-induced diarrhea in dogs. What does this mean for Jaguar Health? Break this down for us.
Okay, well, first of all, the reason why there's so much news is because Canalevia is our active drug agent, crofelemer, and crofelemer is a pipeline within a product. So it's the source, the force of many different products. So Canalevia for exercise-induced diarrhea is a filing within the Center of Veterinary Medicine of the FDA, and dogs who go through extreme exercise, so think Iditarod dogs or military dogs, certain types of hunting dogs, end up getting stressed, similar to human situations running marathons where they lose control they lose control and they end up having diarrhea. So this is a specialty indication that mirrors what we have done with chemotherapy-induced diarrhea in dogs, Canalevia 001, which has gone into distribution this very quarter. And as part of the awareness building for chemotherapy-induced diarrhea, we are hosting and launching the first ever United States Canine Cancer Registry in New York, Madison Square Park on May 23rd. The registry is called Take Charge, which is the Canine Cancer Registry and Exchange. And there'll be lots of vets that are there speaking and lots of Broadway stars with their dogs who are speaking, a fundraiser for Broadway Barks. So it's going to be lots of fun, lots of swag for people and dogs. But most importantly, you need to understand, if you want to protect your dog from cancer, what's the data? What is it by breed, by geography, by type of dog, by sex of dog? And so that's the beginning of the major awareness building for our Canalevia product line. First chemotherapy-induced diarrhea, then exercise-induced diarrhea, and we'll see where we go from there.
Speaking on seeing where you guys go from there, coming into the summer here outside of this, is there anything else investors should be focused on when it comes to Jaguar Health?
Yeah, in the next couple of months, in 2022, we of course have our human cancer trial, but that won't complete until 2023. In 2022, the company that we established in Italy will be initiating and completing a study, an investigator-initiated trial for short bowel syndrome, patients suffering with short bowel syndrome, again, being treated with a different formulation of crofelemer. And we expect to have that data out and published this year. And then in next year, that could be supportive of expanded patient access programs, revenue generating programs in Europe.
So lots to look forward to here. It sounds like you guys got a lot going on under your belt there, but I appreciate your time today, Lisa. Thanks so much for coming out.
Thanks for giving me the opportunity.
Always a pleasure. On that note, I'm going to pass the question off to the viewers. We'd love to know what you guys think about all this in that comment section below. Perhaps we'll do an investor Q&A down the road, and consider subscribing because as news continues to come down the wire, of course, we'll continue to update you here. But on that note, stay cool, stay awesome. And as always, I look forward to catching you in the next one.